slightly. Okay. All right. So my background, a little bit of my background, so you at least know me. So I hail from Pangasinan. I came from a poor family before I migrated here in the United States. I currently lived residing here in the state of Washington, not Washington D.C., but Washington State, because some people think that I'm in Washington D.C. and that's a different part of the United States. So I live here in Seattle, Washington. I migrated here back in 2013. My background, I am a former BPO or call center employee back there in the Philippines. And that is where I met my angel mentors here in the business that we do. I am doing this business part time, 2 to 3 hours a day. And the only reason why I am here is not because probably of the product. I am not doing I am worldwide because I'm one of those, people that is very, negative with this kind of business before. Now I'm currently working as a customer service billing representative for 8 years with Puget Sound Energy. It's one of the largest utility company here not in the United States, here in Washington State. And Mentor Francesca mentioned earlier that I am a mom of one. So I hope that this journey to health I am going to share with you right now will give you a little bit of inspiration, a little hope, maybe if someone here is listening to me right now that are having health issues. So this is a story of me and my son. So um, this is I always say one thing that I hope everybody that are hearing me right now would think of their health, prioritize their health because it's really very hard to get sick. So I my story began in October of 2017 when I was rushed to the emergency hospital because of one afternoon I was just cooking our lunch and I was doing a little bit of exercise and then I got dizzy, so my husband rushed me to emergency just to have me checked just to make sure everything is fine. And that's when we found out that I have a 1.5 cm of thyroid nodule on my left thyroid, left lobe of my thyroid. So that was October. So then after that hospital visit, of course, the doctor would tell me to anyone will tell you to just go ahead and have a follow up with your primary care physician. So that's what I did. I followed up with my primary care physician, but I downplayed it. I was 31 years old at that time, so I said maybe that's just nothing. But then due to the urge of my family, I did follow up with my primary care physician in December of 2017. So I waited for almost like what, 2 months? October, November, yeah, 2 months, right? So then we confirmed with an ultrasound and more testing after that that I have indeed thyroid nodules on my left no left lobe of my thyroid and also on the right right nodule on the right lobe of my thyroid. So after that consultation, of course, the next thing I was told was to consult with the surgeon and have your thyroid removed, right? So we did X-rays, we did thyroid hormone testing just to make sure everything is okay, and thank God all those thyroid hormone testing were good, but then they still wanted me to remove my thyroid. So we had a biopsy done to confirm everything, if it is really cancer in January of 2018. And that's when I learned that I am already stage three thyroid or papillary thyroid cancer patient. And why is it the stage three right away? It's because it's already in my lymph node and we never knew. So it is a slow growing type of cancer, but then because maybe it was not catched by the first ultrasound or CAT scan that the hospital did at the time. When we consulted with the surgeon, said you are deemed stage three. So next thing is of course talks on surgery, do not the partial but total thyroidectomy to remove the whole thyroid out. So I had a consultation March 2018 with a surgeon to prepare for that surgery. We did testing just to prepare me for that surgery, more scan, creatinine test testing was done to make sure I can do the surgery and everything checked out. So I scheduled the surgery in April of 2018, but then I ended up canceling it. That is because I was not comfortable in doing surgery, because one of the question I had with the surgeon back then was, what's the lifelong implication if I am going to have this surgery? And one thing that the surgeon cannot assure me is my voice will not be affected for life, meaning that I'm not going to lose my voice. And I cannot afford to do that, because the type of job that I do, I talk to a lot of people every day. So it's like you're going to take away my bread and butter if I can no longer work, right? Of course, I can still do I am, but how will I do presentation then, right? I, it still it still involves a lot of talking. So then I ended up canceling that surgery and chose to heal naturally. I saw a naturopath right away, and that is inspired by my mom when she was also diagnosed with stage 2 breast cancer. I was still in the Philippines at that time, and we didn't have money for us to for her to undergo chemo and radiation at that time. So we I did all of the research for my mom back then, and we did natural healing for her. And thank God that she is still alive until now. She is with me here in the United States after 9 years, almost 10 years now of having been diagnosed with cancer. So she is also a cancer survivor. All right. So, um, with my will to live, I added, with the therapy that I do, I added alternative cancer therapy and nutrition therapy almost immediately after my naturopath consult. I did high dose IV vitamin C with the protocol, and oxygen therapy, added that in 2019 just for me to be able to live, because I have a young son. So, if there is any mother here listening, you can relate with me that you will do everything you can just to live for your family, right? So, all of those therapies that I've done, it was not covered by insurance. I have to pay them out of pocket. So, as you can see, you can imagine that to get sick with cancer or those diseases that are really, hard on the pocket, right? So I have all of your money going out the door, and that's when I really said, "Oh my gosh, this is going to bankrupt me." Right? So this is me when I undergo those treatments. Back then, I have to have a big bag of high dose IV vitamin C infused into me, and I have to sit down there for almost 2 hours. Sometimes it's even more, depending on how fast the drip is. So all of those that I did, I even added this protocol. If you can see it, this is the nutritional part of it, that every hour I have to juice fresh juice, apple, carrot juice, green juice, and along with that are supplements that I have to take just for me to be able to, heal, help combat the cancer, and have those tumor markers really go down. And all of those things that I did, follow those protocols faithfully. All of my markers were just stable, but then I wanted more. I was not comfortable with just stable. I wanted those markers down. So then I added what we call the RGCC testing. It is a research genetics cancer center testing in Greece. So then this is another money going out of the door. It's $2,100 to test this. They have to draw my blood at a specialized clinic in San Francisco, and then send that to Greece to analyze my blood for more, natural supplements to help me and other even chemo drugs. We did that, but I did not do that part. I did not do the chemo because I'm really not into chemo drugs. So we also tested how well I'm really doing. So we tested, if you can see that there, those are like some like of the chemo drugs and the natural supplements that shows how great they are, or the percentage that it works for me. And then we tested, of course, the circulating tumor cell, how well I'm doing. And when we tested this, it was 2.8 cells per ml of blood. So I cannot deny that I have cancer, right? All of those markers are red, and I want them green. Right? So um, I prayed to the Lord, what would I do, Lord? I cannot go on like this. All of our savings have already gone out the door, had gone out the drain, and I feel so weak. I really want to just heal. So I met Barley. This is the promise of the Lord, Jeremiah 33:6. Behold, I will bring it health and cure, and I will cure them, and I will reveal to them abundance of peace and truth. So this promise of the Lord came September 2020 when I joined I Am Worldwide. I met I Am Worldwide through my angel mentors in this business. They are my friends. Back in my call center days, Mentor Meros Corpus and Mentor Josh Donegan Jr., I owe them everything. I say my life, maybe of course to the Lord then, but of course may they use the Lord used them for me to be here in front of you talking right now, because if not for them, maybe have been long gone, right? If I have not met Barley. So I met Barley in 2020, and that's when I started seeing changes. So the first thing that I've noticed, of course, is my strength. I have been always weak, always dizzy, feeling nauseous. I don't have strength. I feel like a zombie working every day. Before diagnosis, my husband and I love to go outdoors, hike the beautiful mountains of Pacific Northwest. But those have been paused, have not been doing because of the diagnosis. But I put Barley to test 1 week after drinking barley, and we were able to hike Mount Rainier again. So thank you, Lord, right? And those things that I've not been able to do with my family, more outdoors, with my son, with my family, things that I cannot eat, I am able to eat because of barley use. All right. And when it comes to difference in cancer marker after barley use, I'm trying to rush my presentation because it's already 12 minutes, right? This is my marker. The highest I ever got was 126. This is what we call the thyroglobulin cancer marker. It's the marker for a thyroid cancer patient. And before barley use, this has just been like a stable up and down above 100, 100 to 126. And with the use of barley, um, this is May. I'm showing you the very latest already. No, I can't show you all of those in between that. So we're not gonna, take long with this presentation. So May 23, if you can see that, 97, thyroglobulin 97.3. We repeated that again in September of 2022. And I will show it to you later. But this, I wanted to show you the OncoTrace RGCC that I repeated that test again in April of 2022. Though the 2.8 earlier, it went down to 2.4 cells per ml, and I'm happy, even if it is not under 2 yet, because my doctors say if you maintain under 2 cells for 3 years, you are already considered under remission. And that's our goal right now. So I cannot deny the fact that barley is doing the work for me, right? And of course, other things that I'm doing. And this was me when I had that ultrasound. That day that I had the ultrasound with my primary care physician, and looking so beautiful, but look at what cancer does to someone. This is my mom and I. When I had my blood draw for that RGCC in San Francisco, I look so old, older than my mom. And look at the difference what barley does to you, to someone. See? So what do you call this? I said this, I nagmukhang tao in Tagalog. I don't know what the English of that is. Right? So, nagmukhang tao na si Mentor Andrea, right? So, look at that. So, I started gaining weight. I started getting that glow back in me. So, thank you, Lord, and thank you for our barley. And this is the very latest of that thyroglobulin cancer marker test. I did this in September of 2022, so few months ago. It is 64. And the normal for a person not having cancer, thyroid cancer, is 40 and below. So thank you, Lord. We're almost normal. And I am not surprised that if I'm going to test that in a few months, that it is already normal. I can feel it. I just can feel it. Right? So thank you. And this is the story of my son. So my son has hydronephrosis condition. Um, It is characterized by an excess fluid in a kidney due to backup urine, causing the kidney to dilate. So lumalaki. It's getting bigger. So he was diagnosed of that since in my tummy in utero. So that means to say that I'm he's still in my tummy. He's not even been born yet. We've already seen something wrong with his kidney. So we followed up with this case. And they said it may go away after birth, but then with the case of my son, it did not. So if you see on this follow up after birth, 7 to 10 days after birth, it is still there. So we were sent for a VCUG after this since it's still there. We wanted to just make sure that his kidney is growing and maybe it's resolved. So we were sent for a VCUG, that is few months after birth, at Seattle Children's Hospital, and I was confirmed it is still there. So he was put on VCUG is voiding cystourethropy procedure where they have to catheterize the kid. Uh, they the pennies of the kid, and they will inject like a saline water with a dye, and then scan it and see if he pees that or not, if it comes out or not, and it did not. For not of all of it came out for my son. So he was put on antibiotics since birth just to what do you call this, avoid UTI, because he is because of the urine backing up. So he has a tendency to get UTI. So we follow up. If you could see this, all of this tests that we keep doing for my son every so often just to check him. And we just did not follow up most of the time during COVID because of the fear that he would catch COVID. But then we repeated that a few months ago this year. So the grade of my son's BUR is grade 1 and grade 3. So that's how they grade it. So with my son, I started him with barley also almost at the same time. He started with choco barley, and almost at the same time, I started with taking barley. He did also. So he loves barley. He's not picky. Thank God. And we repeated the VCG, no, the ultrasound, May of 2022. And lo and behold, thank you, Lord. He is all clear. No, the kidneys on both sides are normal. No backing up of urine. This is him now, very healthy baby boy. So I will leave you with this story of a bleeding woman. If you are someone right now that is losing hope, if you're having any health issue, remember the promise of the Lord in John chapter 1, verse 14. He was full of unfailing love and faithfulness for all of us. The bleeding woman I can relate to the story in the Bible because it's like me, right? I've been having this cancer journey for so long now, and I've been like wanting to heal. But then with the woman, I draw my strength from the story because for 12 years he was bleeding, but then he just touched Jesus' cloak. She was healed. So for me, I can't. I might not be able to touch Jesus' cloak, but my faith is there that I'm going to heal. Right. So I hope that you could draw something from the story also if you are someone that is battling health issue right now. So thank